Looks like we're up. All right. All right, just to help you real quick, Corson, I'll get it on our evolution and the hub quick. So you're not scrambling here. All right. Hi, everyone. We're just bringing it up and getting the share. So if as you're coming on, please share it yourself. Looks like Jordy's coming on now. And this is we have a really full house here for this town hall about Green Phase reopening. Just another minute and we'll go around and introduce ourselves and you'll get a chance to see all the special guests we have. We have some wonderful we're really excited to have this discussion about how Green Phase is going for everyone. All right, so again, as you know, this is nothing new for me. I'm Michelle Siegel. Tonight we're going to talk about Green Phase reopening and hear different perspectives from different people throughout Pennsylvania and in the district. First up, I'll have everybody introduce themselves. Let's start with Jimmy.
Hi, how are you guys tonight? I'm Jimmy Sabatino. I am co-owner with my siblings of all the Vesuvio pizzerias, and I'm the chair of the first district for the Luzerne County Democrats.
Okay, Eileen.
Hi, my name's Eileen Kelly. I'm a registered nurse here in Northwestern PA. I got involved with Nurses of PA about 2 years ago. I've since been elected to the board of directors for Nurses of PA, and I like to advocate for anything in healthcare, but right now our biggest focus is on COVID-19 and how we safely move into the reopening phase. So I'm happy to discuss everything with you guys tonight.
And thank you so much for joining us, Eileen. Kim.
Sure.
Hi, my name is Kimberly Aldridge. I'm also in Northwest Pennsylvania, and I'm also with Nurses of Pennsylvania. My focus is in long-term care, nurse education, and we also focus on the COVID-19 and also safe staffing.
Thank you so much for joining us. Sam.
Hi, I'm Samantha Pearson. I am basically a community member involved with Hub for Progress, and also in my professional life involved with community and economic development through Lewisburg neighborhoods in collaboration with local organizations like the Lewisburg Downtown Partnership and statewide with the Pennsylvania Downtown Center. And mostly that is, I do neighborhood revitalization. Right now, a lot of the services we're providing are very much public health messaging, and we've been doing a lot that has to do with trying to explain how critical public health is to the economy, and that we can't just have a good economy without some maintaining health.
Thank you so much, Sam. Shelby.
Hi, my name is Shelby Strohmeyer. I'm a registered nurse up here in Northwest Pennsylvania. I'm also running, I started off with the Nurses of Pennsylvania with Eileen and Kim for 2 years ago, and now I'm running for Senate District 21. I got into this because of the public health issue and what needs to be fixed in order to make our public health healthier.
All right. Thank you so much for joining. Shelby is a great candidate, and I got to know her from Emerge, so and her and I are pretty close. So so glad that she's here and was able to get some other amazing nurses to join us. All right, Kate.
Hi, I'm Kate Wilson. I am an RN. I've known Shelby for quite a few years. I've worked for the state. Currently, I am working out in the public, and I'm here as an advocate and as an extra set of eyes.
Thank you so much. Jordy.
Hi, everybody. Can you hear me okay? Great. My name is Jordy Comis. I wear a lot of hats. I think I'm here mostly wearing, I'm a borough council for Lewisburg. I'm the vice president of the Lewisburg Borough Council, which also means I am on the Buffalo Valley Regional Police Commission. I'm also on the board for Lewisburg Neighborhoods, which is the board that the organization that Sam works for. And you know, I think like a lot of folks, I've just been very focused on how can we balance COVID safety with encouraging resilience and adaptation. I think there's been a lot of great things, but sadly, I think a lot of the political narrative is around this dichotomy of like reopen, not reopen, and I think it really kind of undersells how much creativity and innovation there can be in local communities around economic resilience and community adaptation and all kinds of ways. So hope we can hear some of that tonight.
Thanks so much, Jordy. And Eileen. You need to unmute here.
Sorry. There we go. I'm sorry.
That's okay.
I just wanted to add that I'm also a dialysis nurse, so I wanted to let everybody know a little bit about that situation tonight, because with the COVID-19, our dialysis patients cannot quarantine. They have to have dialysis. So there's some special rules that we have to follow to keep them safe and keep us safe. So I was going to discuss a little bit about that tonight also.
And that would be fantastic. And I think that's something that I would personally love to hear more about, because that's kind of things that I've thought about in my head. I've spent a lot of time in and out of the hospital myself. And I've thought about some of these situations where people have treatments that they have to get it doesn't matter. Like, and I've thought about that. So I'm very excited to hear more about that situation. So
great.
Today we're talking a little bit again about reopening, how it's been going in the green phase. So why don't we start with when all this started? One of the first guests we have on our town hall was Jimmy. And this is when we were in lockdown. Now Jimmy owns a pizzeria, family pizzeria. So they were considered an essential business and was allowed to stay open for delivery and takeout. So he has literally seen the progression, and his restaurants are in Luzerne County, which was a county that was hit pretty hard, and also a county whose numbers is ticking up there pretty good again. So would you like to talk a little bit, Jimmy, about how this transition has been and how your restaurant has transitioned from each of the phases, and what your occupancy is and things like that are now?
Well, it's been a rough transition. The lockdown started on the 16th of March, which was a Monday, which in the restaurant world, that's probably the best day to change something. All of the other changes, like going from red to yellow and yellow to green, have occurred on a weekend, so Friday, which is the worst possible day you can make changes in a restaurant. We've gone from red to yellow, really wasn't that much of a difference, except we were allowed to open up our patio, which was, we were able to do it at 75% capacity. Well, no, when we went from red to yellow, it was 50% capacity. And then when we went from yellow to green, it was 75%. We were originally allowed to open up our bars when we went to green, and the governor changed that, but he also only gave us 8 hours to make those changes. He did it on a Wednesday going into a Thursday. So, I mean, I applaud the governor and Dr. Levine for everything they're doing, but I kind of wonder if they've ever worked in the restaurant industry to know how hard it is to change something in 8 hours going into a weekend. You know, you've staffed up, you've brought people in, you took reservations, you've ordered product in, and now your whole way of doing things has to change. And usually like they're pretty good about the guidance, but this last change, they actually changed it with no guidance, and then they put out a whole bunch of new guidance through the LCB. So it's been an adventure. Every day you come into something new. It's been hard to get product in. I know like at one point in April, cheese for the pizza was like all-time low, $2.19 a pound, and now it's at an all-time high. It's $4.19 a pound, and we really didn't change the price, so we're just absorbing that for now and hoping that everything stabilizes again. It's been amazing to see how people have gone from being really supportive of the restaurant industry, and we want to keep our local restaurant open, to you can't tell me to wear a mask, or to still be even more supportive now. It's just been, like I said, every day's a new adventure.
I mean, I think what you said there was important, because like through this, I mean, again, I think the governor and Dr. Levine are doing, but I think there's some things that have made me just like, what, like, you know, like I think, well, let's be honest here. I mean, there has been some stuff that I think is a little bit, that was fast. And I thought about that. I thought about how are those restaurants all of a sudden and bars going to do with this in 8 hours? That was a lot. And you've been patient and very flexible, but I mean, the estimate that I've heard is 40% of businesses and restaurants could go under in this next year. And it's issues like this, right? So again, I appreciate how patient you've been, because you've been, you know, sticking your hand out, but I can't imagine what it's like to have to, you know, be bearing the brunt of the mask stuff, because unfortunately it's the businesses and the restaurants that are having the mask stuff, and the employees having it, and nurses that are having it taken out of, which is not fair. Right. McDonald's just said that as of August 1st, they're going to mandate masks, and I feel bad for those employees. That's not going to be a fun situation when that starts. Yeah.
It's a little rougher for McDonald's, because the employees there really can't tell people to get out like I can. So, but going back to something that you mentioned, 40% of restaurants closing over the next year is a pretty scary prospect. You do not realize, well, you do, but the average person doesn't realize how much the restaurant industry keeps things going. We buy things not on a monthly basis or even like a bi-monthly basis. We buy things on a weekly basis. So we're putting money out into the economy on a weekly basis: produce, poultry, meat. We're constantly buying things, but we're also constantly paying people. We pay on a weekly basis. So, I mean, lucky for me that I'm in the 60%, that I think I could survive the next year or two, even if it stays like this.
That's because his pizza is fabulous, and you should go there. And I can't wait now that we're in green, because I like, my dad literally is like, when are we going to Jimmy's? Because I'm not kidding. Like, I'm not just saying that because you're my friend. Your pizza is phenomenal.
I mean, it's a secret family recipe for 45 years now. So, you know, I think we learned how to do it by now. Mm-hmm. But it's just scary, though, all these other restaurants, when they go out of business, the impact that they're going to have on the rest of us, because those restaurants buying things helps keep the prices down for everybody. So even if they're only buying, like, say, $1,000 worth of product a week, but there's 20 of them, that's 20,000 worth of product. That helps keep the prices low for everybody across the board, you know, and like, people don't realize the impact that businesses closing around are going to have on our economy. And the most simple and basic human thing you can do right now is to just wear a mask. That's it. Yeah. Just wear a mask. So if there's one thing I can ask you, is to wear your mask when you go out in public. It's common courtesy for your fellow humans at this point. And if there's another thing I could ask, is just be nice to the people in the restaurant, because we've had it. I'm not going to lie. I'm not going to sugarcoat it. We've had it. And especially people like me, and I have a friend that works in Columbia County as well. We are trapped in the restaurant. I'm working 7 days a week now. And we want to be out being activists. We want to be with you guys at the protests. We want to be doing more than what we're doing. And we can't, because we are trying to keep a business afloat and people employed and money flowing for the economy. And so I did manage to sneak out to a Black Lives Matter protest, but I was completely masked, like I wore my Guy Fawkes mask and was only there for a couple minutes. So, but I didn't get the opportunity to go to all the protests that I wanted to go to or do all the things that I wanted to do to help. But over the past couple months, I'm pretty sure we hit about 4,000 pizzas donated to the hospitals, the testing sites, and some of the doctors' offices around the area, the ambulance company. We made dinners for 12 families once a week. Fresh fruit for the local hip center. We did as much as we could, knowing that we'd be trapped in the restaurant at this time. So, we're trying, and we want to be there with you guys to fight the good fight. So if you don't see us, know that we're there in spirit with you.
Well, I mean, and that's the one thing is the government has got to do a better job of getting money to the small businesses and essential and healthcare workers and the people that have putting their, for lack of a better term, butts on the line to keep everyone moving and keeping everything open, instead of it going into, I mean, I just saw another story, went in another billionaire's pocket who just had a quarter off the charts. They don't need this money. It needs to be going into working people and working businesses that are keeping these economies afloat. And I cannot stress that enough, that I wish our government was doing a better job of helping people through this right now. Because they are to an extent, but
Right.
it's coming on your shoulders in a way that it's unfair. Let's be honest. It's not fair.
I mean, it would be better if they started out with like helping the people who need it the most, the lowest income, and then graduated up, but they're going the opposite way. They're starting at the top and they're working their way down. I mean, lucky for me, my business is somewhere in like a couple rungs up the ladder that I can hold out and wait for help if I need it. But I think the government doesn't understand at this point that helping out the wealthy, the high income, those people either those companies use it for stock buybacks. Those wealthy people hoard it. The people that need it the most are the people that are going to spend and keep the economy moving. I mean, starting at the bottom, if they have a little bit of extra money, they take their family out to dinner. They buy the video game for their child. They do a lot of things that wealthy people and well-to-do people don't do. So, I mean, we should start working from the bottom up. This trickle-down stuff has never worked, and it never will.
Absolutely. And like, again, it's been 4 months and we were given $1,200. I don't know who thinks you can live on $1,200 in this economy and the way America runs. You can't. And you know where my stimulus money went? My husband and I together? Our dog ate a dryer sheet and had to have emergency surgery. That's where my stimulus money went, literally to save my dog's life. Like, that's the thing. Like, that's what's going on with average people. We have emergencies. We live paycheck to paycheck. I'm lucky. My husband has a good job. He has, because they work with banks and hospitals, they were considered essential from the beginning, and he was allowed to work from home. And he's still been working from home. And that's been in a little bit of like get out of the house situation. But,
like, come up here,
Yeah, exactly. But like, people don't understand that I think the stat I saw, like 80% of Americans couldn't survive like $1,000 emergency, and that is scary. And then the other statistic I just saw that's scared out of my mind is they're projecting within a year there could be 28 million Americans homeless. We have 600,000 homeless people in America right now. 28 million? That projection should horrify people. And again, it's because we're not realizing that how fragile all this was, right? Like, I think COVID is highlighting a system that was just on the brink of a disaster. We've seen businesses like in the 27th district, let's be honest, there were businesses closing before COVID. COVID has made that worse, like that textile company in Sunbury just closed, and a large restaurant in Sunbury just closed. And we're going to see that as this goes on here. But, you know, in central Pennsylvania, stuff was not good before COVID either, if we're going to be honest here. And then all this has done is put us over the edge and showed us, and again, we're going to talk to these lovely ladies on here, that you guys are the one making the world go round, right? Like, if one small plus thing happened, it was that we realized that the person working at the gas station is important. You need that person when it's 2 o'clock in the morning and you don't have milk, right? Like, that's been the plus for this. But the negative is, we've seen now, we've put such a burden on working people and small businesses. I just am getting very concerned about how sustainable that is. And Sam, do you want to jump in on that? Yeah.
I just wanted to point out that, yes, we've been teetering for a long time, and this is just pushing us over the edge. So a lot of businesses that have been sort of stressed by tech disruption and stuff like that, this is going to be the nail in the coffin. But the other thing we have an issue with that this is highlighting is, like Jimmy was referring to trickle down, is we have a very screwy idea of cause and effect and how things happen and when they happen. We have not seen the consequences yet financially. We've sort of been, and people do not understand that they've already been sort of in the same way that we have already locked in cases and then deaths for COVID, we've already locked in decline and sort of terminal situations for businesses. So actually Lewisburg lost a business this week, and people literally said, why? And it's like, seriously? Are you really asking why? But it's also notable because it's like, this is the beginning. Now, we also don't know what the outcome will be because it's a function of what we choose to do. There's so much writing. There has been so much writing on the various bailout packages. Right now, we're waiting on another bailout package. We know that the eviction moratorium is ending. That really huge number for homelessness for next year, it's anticipated in a month it could, leap basically by tens of millions. But it depends what happens, right? It depends what happens this week in Congress. They're debating whether they're giving people too much in unemployment compensation, and that's, stymieing their return to work. It's like, no, hate to break it to you, we have a global pandemic, and that is stymieing people's return to work. It's a really complicated situation, and that failure to sort of really understand cause and effect is a bit of a crisis.
And Sam, why don't we take a second, and why don't you take it a little bit here and start giving us a little bit of information on the numbers, and then we can transition to the nurses on what they're seeing, go from business numbers to medical.
Okay, sorry, when you say numbers, you want the COVID numbers, or sorry?
Yeah, like give your, you wrote that beautiful piece that you put on Facebook and stuff. If you want to just like give us a little synopsis of that and kind of explain to people what is going to happen here. Because what I'm looking at is I see August being a disaster of a month. Can you expand a little bit of that and explain what you're seeing?
Sure. I actually, so I'm working right now. A lot of people are watching Worldometer, or however we pronounce that. They have all these numbers, the local numbers, the state numbers get announced every day, and people fixate on them. They see how many new cases and how many new deaths. What we don't tend to realize is new cases is an indication of what's going to happen, and new deaths is an indication of what has happened. And then everyone starts looking at, well, let's compare the total number of cases to the total number of deaths. Total number of cases is actually a combination of past and future information. So you actually need to separate that out into active cases and resolved cases. And you need to look at how many deaths per resolved case there have been and how many active cases you now have, looking ahead at what the implications are. The simple implications at the national level for us are that we have as many new active cases as we've already had resolved, and we know what the death toll was so far. So basically, and people are like, but Florida people haven't died at the same rate. It's like, they haven't died yet. Sorry, but I mean, things might, you might luck out a little bit, but there's sort of a range, and we're probably looking at a minimum of a doubling of where we are now for deaths, and that is if everyone does everything right from here on out. And that's sort of clearly inconceivable to people. Like, so I am working on a graphic that tries to explain this. And it is hard. I don't know exactly what the fatality rate is going to be, case fatality, infection fatality rate. I do not know. I can just look at what has happened and project from the most basic numbers we have a general idea of what we're looking at going forward. I'm also trying to look statewide, and so my region is a little bit smaller than your area. Michelle, I'm focused more on sort of the valley, like Snyder, Union, Northumberland, and Montour. And that area is about 200,000 people, which is sort of large enough to mean something, like for the numbers to work. Whereas many of those counties are too small. Like, you look at our stats and it's just like a bouncing ball. It doesn't mean anything. But if you do aggregate them, it's really interesting what you see. Basically, you get the lockdown started and we essentially had no cases yet. But within that first month after the lockdown, we did have a rise in cases that was starting to do this. And as soon as the lockdown kicked in, we started going just at a continuous upward line, but it's been linear ever since for 4 straight months. Even through the reopening that we have had, but we haven't had schools and we haven't had universities. So we're about to shift into a totally different environment. And we know that we are not on our best behavior. We actually have people exhorting us to not wear masks and to defy, all sorts of public health measures. Unfortunately, some people being more vigilant does not make up for other people being less vigilant. And that's really the bind we're in. I don't know if that helps enough, but I'm working with you and Kristen actually on this Spotlight Orange effort, where we're trying to just get across to people, like Jimmy said, wear the mask. We need to do the public health messaging, because the economy is a function of public health.
Yeah, exactly. And Jordy, you want to pop in there and say something quick before I pitch?
Yeah, sure. Just real quick. First of all, I love, Sam, how you explained, total cases captures both the past and the present. And that is so simple and clear. And I'm not as an avid consumer of COVID news as I know as you are and some people. But I don't feel like I see that out there. Like it seems like the media in general have completely dropped the ball, and they're treating this as like almost like a baseball season, right? Like, what's the total number of wins for the season? But that's meaningless. So just hats off for that. I just wanted to share 2 little tidbits. I mean, one is the unemployment rate in Pennsylvania went up to around 15% in April, came down a little bit towards 13% for the month of June. And in that same time period, and I put a link for the other folks on the Zoom chat that goes into this, Pennsylvania used to have 10 billionaires before the pandemic. Now we have 11, right? So this, just coming back to one of the earlier conversations, that the focus, I think, some of what Jimmy pointed out, there's been a lot of legitimate frustrations about the execution of the COVID plan. But overall, we're in a context where people still have this idea that, a rising tide lifts all boats. And so things are going to be okay. And I always thought that metaphor is kind of problematic because it imagines that all the boats are the same, but some boats have holes in them, but some are anchored to the bottom. So when this tide starts rising, those boats are going to be swamped, So I just wanted to throw that out, and I think Chris can probably capture the report from the Pennsylvania Budget Policy Center. One of their programs really documents really well this, the way that this has exacerbated the gap between the haves and the have-nots.
Yeah, I mean, I agree. I didn't know. That's insane that there's another billionaire that made it out of this.
Well, and it's almost the same, right? It's a 10% increase in billionaires and, a little bit more than a 10% increase in unemployment.
Wow. That just angers the heck out of me. I don't even know what to say right now. If anybody listening that should be a graphic. We need to work on a graphic for that, Jordy, because I think that would wake some people up, and I want to talk to you afterward about doing something with that. All right, so let's talk now to some nurses that are literally dealing. I have a special place in my heart for nurses. I mean, Shelby can attest to this. This is like why her and I bonded right away. Since the day I've been born, I've been in and out of hospitals. It's been just the way my life has been. And it was nurses that would stand by my side when I was at death's door, looking at the doctor, because when you're in the hospital, your nurse is with you for 8 to 12-hour shifts, few days a week. They know you. Your doctor comes in for 20 minutes in the morning to check on you. It was the nurses that would be like, there's something wrong with her. You need to do something. It was nurses that saved my life. It was nurses that advocated for me. It was nurses that saw that I was going into sepsis, even though the doctor said that was impossible. It was a nurse that said, no, she's burning up. Her heart rate's, her blood pressure's crashing. There's something wrong here. Listen to her. So nurses have a special place in my heart. I will defend them till the day I die, because I think that they do everything, like literally, they literally are cleaning up the poo, and they're literally in the surgery helping a surgeon. Like, that's what people need to understand about nurses. They're not this version we have in our head. They're working constantly, and I can't imagine what this extra stress of COVID is doing. My mother is a healthcare worker. She is a endoscopy tech, but her unit got closed down because it was too dangerous. So she volunteered and worked in the COVID unit, and the stuff that she saw and told me just broke my heart. And she's also, 62 years old. So there's also the fear of, what if I get it myself, right? Like, people don't understand that's going on with healthcare workers right now. They're saving people's lives literally, but they also are scared because they could contract this and take it home to their family too. Like, you're literally got your hands in it. So let's start with Shelby here, and then you can talk a little, introduce the team that you brought in. So Shelby, what are you seeing? What's your synopsis here?
First of all, let me give you my background. I worked oncology for 10 years. 2 years of that was charge nurse. I got into this because I knew Pennsylvania was sick. Pennsylvania ranks number 3 in the country for cancer. We have a lot of sick people. I've watched the numbers, and I don't know why anybody hasn't addressed the fact that if you look at the numbers, we're with the amount of tests that we've done, which is only like barely above 1 million, as compared to other states that have done multi-million. They have maybe 400,000 or 500,000 cases, but they have so many less dead. Pennsylvania has a lot of sick people. Pennsylvania also, since 2016, our kids are getting sick. Cancer for kids under the age 18 has become the number 2 cause of death. Auto accidents is number 1. And now you put the autoimmune diseases that we're facing as well. You bring all these people together and you're going to have problems. Rural Pennsylvania wasn't tested. I mean, like our area, if you needed a test, you had to drive 60 miles plus to get tested with symptoms. People went home. So then as soon as they started testing, well, guess what? We had patients.
Shelby, I think we lost your mic. All right, I'm just gonna, Shelby, I think we lost your mic there a second. So why don't we, her mics, this happened something. Again, this is the issue of rural broadband. So this is the other issue going on in central Pennsylvania. Kate, why don't you, oh wait, is she back?
I beg your pardon?
Sorry, your mic jumped out there a little bit.
Okay, how far did I get? That's what I was afraid of.
You just had finished up with the issue with cases and testing.
Okay, we have a lot of sick people in this area. A lot of people who don't realize that they are sick. We have a lot of autoimmune diseases. Venango County, which is in one of my districts, is #1 for diabetes. When this first came out in rural Pennsylvania, up here, it was cold. People stayed home. They didn't do anything. So what happened? We opened up the doors, we opened up the state, and people went outdoors. People came home to check on these people, and the mask came off, and guess what? We have cases. Now, if we don't protect it, our hospital up here probably has, what, six vents? What would you say, Kate, about 6? You know, and that's how rural Pennsylvania works. We're going to be in a very bad situation, and they expect the nurses to just fix it. There's not enough of us to fix. Over 900 healthcare workers have died since this started just going to work. 500 essential workers have died just going to work. And then recently I did a questionnaire. I'm on different sites with nurses so I can find out what's going on across the United States and around the world. I posted a question. Hey, nurse here, 31 years licensed. I am hearing this, that nurses are walking off, nurses are no call, no shows, or just calling in and quitting. I had 400 replies, and I'm still getting replies. And the scenario is, oh yeah, I did it. I'm never going back. I took 8 years of early retirement. I can't do this. I can't take care of 30 patients. I can't work ICU and take care of 5 patients on a vent. You know, and this is what they're not telling you. This is not what they are telling the public is going on. And then on top of that, the public has started to blame nurses as the reason for the spread. They see the scrubs and it's your fault. And all these nurses are doing is going to work and coming home. They're working 16, 18, 20-hour shifts. And a lot of them haven't even seen their kids in weeks because they live in basements. You know, there's got to be a happier medium, and you can't put all the blame on the nurses to fix this. We want it out in public health, and we want it in the hospital system, and it's not going to work.
Yeah, I mean, you're exactly right. The one thing that, I mean, the issue with the traveling to get a test done at a like Geisinger or a facility like that here, like in Selinsgrove, if you want to go get tested at a site, like you got to, through a Geisinger, you got to drive to Bloomsburg. That's a 45-minute. And if you're not, I had a conversation when I called the emergency number. I said, so if you're not feeling well and you're having trouble breathing, you want somebody to get in the car and drive 45 minutes for a test? That doesn't make any logical sense. Like, that's a disaster waiting to happen too. Like, the thing about COVID that, you know, the stuff that I'm seeing is people for a second, they might feel a little bit better and stuff. They get in the car and all of a sudden the oxygen drops, and that's a disaster waiting in. And again, this is an issue that's hitting rural because we don't have these test facilities up and running like they have in more urban areas. And
another thing is they're expecting asymptomatic nurses to go to work and just take care of the COVID patients. They're not even quarantining, or if you have 3 days after your fever's gone, and anybody who's had this COVID will tell you it stays forever. They want you back at work. And if you're not back at work, you better have a good reason why you're not back at work taking care of 20, 30 patients. That's not even conceivable. I don't know anybody, and these are women. A lot of these women are in their 50s and 60s. How can you expect, and a lot of these other women have young children. 90% of healthcare are women.
Yeah, I mean, that's true. Yep.
You can't, it looks really good on paper, but you know what? When you have to do it, it's a whole different story. And nobody understands that. And the nurses and the healthcare workers and the essential workers are supposed to be our heroes, but nobody is showing it.
Yeah, I mean, I think what's also getting missed here is like when my mom was in the COVID unit, these people, like she told me they were having the family members record goodbye messages in case that person was going to die at 2 a.m. and they couldn't get on the family to get on the phone, that we could sit, people don't understand what was going on. And my mom was sitting and holding people's hands as they were dying. That was her job. And then somebody had the audacity when she had a mask on and went to the gas station to call her an a-hole because she had a mask on. And my mom said, I could literally have this disease. I am around these people every day, and my mask is protecting your butt, and you're calling. That is what's scary here. It's feeding down, and we are literally questioning the people that are watching this with their own eyes. Another family friend of mine, she is a nursing home worker. She just shared a story with me where there was a family that the guy was on the vent for 21 days, and it was at the point where the doctor said, that's it, he can't be on it anymore. We're gonna have to pull him off and see what happens. 2 hours. The family had to make this, and he to completely pull him. He didn't even make it 2 hours. And she said, when people start telling me this isn't real, and I had to watch a family pull the plug on their family member, it's infuriating to me. She's like, I had to go hug that family while they bawled. And I have people telling me, I'm not gonna wear a mask because this is fake. And that has to stop. And if you're watching this right now, and you think that masks are an awful conspiracy for some strange reason, then I am going to say something to you. The next time you have surgery, you tell that surgeon to take that mask off, because if it's not doing anything, they can breathe in your open wound, and let's see what happens. And that's what I would like to say to you. Because
well, actually, I got into an argument with somebody. A bunch of people one night decided to nail me. I was preaching. So I put it very simply. Okay, you say it's your civil right not to wear a mask. Let me send you a waiver that says, because you are following your civil rights, you will sign this waiver that says you will not endanger healthcare workers if and when you need hospitalization, that you will stay home and take care of yourself.
Yep.
Because they were coming at me so hard that this was all fake and this isn't true and I needed to stop preaching. Sign the waiver. That stopped all of that right there and then. But I was a little angry that day.
Well, I don't blame. How about Kate? I see you nodding your head and stuff to some of this. How about you tell us a little bit about, what you're seeing? You're gonna have to unmute.
Hi. So what I'm seeing is that there are a lot of nurses in the area that we live that when all of this started, maybe they worked midnights and so then they went to Walmart to get their groceries or what have you. And it has gotten to the point where the public literally will follow you to your car and say something threatening and intimidating and then leave. It has shook enough nurses that they all are using the app now to go get their groceries, have them brought out to their car. But here's the thing that gets me. Every day, it doesn't matter where I go, I have my mask on, my family has their mask on, but undoubtedly there is somebody, and like Shelby said, I was on that thing on Facebook where they verbally attacked her. And, people don't get it. Why don't they get it? I have no idea, because they want to choose to do whatever they want to do. That's it. But here's the thing, it's very real. So I am a charge nurse and I see a lot of different parts of COVID. And I talk with a lot of other charge nurses and hear what they have to say about the COVID unit. And there is not, and I said this in the very beginning when this started, and that is, there is not a single one of us, not a single American is going to get out of this unscathed. In some way, shape, form, or fashion, COVID is going to touch your life. Now, whether that be financially, personally, physically, emotionally, it's going to touch you. And what blows my mind the most is that our numbers today are worse than the numbers were when we shut down. But now we're going to open school up and we're going to expect our children to go. And I've heard more parents in this last week say things like, if they don't open school up, I'm going to lose my mind. Well, school is not a place that you send your child to be babysat. School is a place you send your child to be educated. If you can't do it, Okay, so you're expecting your child to go be 6 feet away. You're expecting preschoolers, kindergartners, first grade, second grade, third grade to wear this mask, 8 hours, put their mask on, get on the bus. How many kids, seriously, are going to do that? They're not. It's going to be down here. It's going to be in their mouth. It's going to be hanging off their ear. It's going to be everywhere. And I love children as much as the next person, but they're germ factories. So, and how many parents or grandparents or foster parents that take care of these kids have immunocompromisation, have some underlying condition? So we're going to let our kids go out there. They're going to be all around each other. They're going to come home. They're going to get somebody else sick. And basically what will happen is you're going to end up with a whole population of children that aren't going to have family because family is going to be sick or they're not going to be here. Or God forbid, they're going to get sick with the COVID related disease. I am so over listening to people say, it's my right. It's my right if I don't want to wear a mask. Okay, well, that's your right if you want to die, but it's not your right or your privilege to kill me or my child or somebody else. I don't know where we have lost sight of. In the beginning, it was all about, they're the heroes. The nurses and doctors are the heroes. Respiratory therapists are the heroes. People going through the doors of the New York City hospital, President Trump called them the heroes, the angels. And now everybody just wants to be like, look at us like we're the ones that are diseased and we're out there spreading it. And that's not the case. But this is another thing that irritates me as a nurse. And that is, okay, so we did not have a COVID testing site in this area. Shelby is absolutely right. And if we wanted to be tested, you had to travel to another county to have that test done, which means your PCP had to give an order. Well, now Walmart here is allowing those tests, but here's the but. Only 3 days a week, only 50 tests a day. Period. Only. Now, my daughter is really sick, and I've been to Cleveland Clinic twice, and she's been hospitalized over there and in Pittsburgh. And each time at Cleveland, she's had to have a COVID test. I can tell you, the first time you see a COVID testing center, it shakes you to your core. When we sit in line 100 cars deep to go down in the basement of a parking garage to see hazmat suits and the whole 9 yards to get COVID testing done, 4 cars at a time, it shakes you to your core. So the question I have is why, if Ohio can do that, why is Pennsylvania not doing that? Why is it, who dictated that this county that we live in only gets 150 tests in 7 days? How do you know? And then out of those tests are only if you're actively with COVID. Not that you've had COVID, not that you have the antibody for COVID, but you're active for the COVID. And I personally know 2 different stories of somebody being told the family member was positive. They went to their place of employment, said, listen, this family member is positive. They live in the same place with them. And they were told, unless you get symptoms, you come to work. Okay, so we're not self-quarantining. Where I live, there's an establishment not far from where I live, and every place tries to find a loophole. Like a gym that I belong to, when they opened it up, and they said they allowed people to go back to the gym. They got on Facebook, of all places, of all platforms, and said, wear your mask to come through the door until you get your temperature taken, then take your mask off and enjoy your time. What is it we're not getting? What are we not getting? What are we not getting out there? I know as nurses, it's our job to educate our community and be there for community health. Where is the breakdown happening? Because wherever it is, we've got to find it and find it quick, because if we don't, Shelby and I have talked about this. Come fall, it's going to blow up. I really believe that. And we're going to be looking at something far worse than we ever had before. And people just, I don't know. I'm so frustrated with the whole thing. You know, I'm frustrated that I have to literally tell staff members that get a hole in their mask. And they say, what am I supposed to do with this? Get another one. Like, get one. Like, I don't know. And then you see these people that you work with and they're like out and about. They're not wearing a mask, but yet you know you're going to go to work with them. So it's just very frustrating. Nobody is protecting anybody unless you are personally being accountable to protect somebody else from yourself. So that's what I have to say about the whole thing. I think that it's ridiculous. I understand that we know we have to open schools back up, that children, you know, there's many different assets to children being in school and being out of school. We talk about the kids that are not fed, kids that are abused in bad situations, but there has to be a different avenue. Somewhere there has to be, because if not, to go back 6 months from now and say, well, we should have done this or we should have done that, we're not going to be able to. It's going to already be in the books.
No, I agree. I mean, this is something that I have thought about a lot. I mean, other things that have been highlighted because of COVID, right? Like, we have a childcare crisis. Schools are not babysitters. Like, teachers, again, another group of hardworking people that we completely don't treat very well in this society, right? It's not their job to babysit people. And that is the main pushback that I hear about opening schools, right? It's not that my kid needs to learn. It's not that kind of thing. It's, I have to work. What am I going to do? I can't homeschool. And that's a disaster waiting to happen right there. And you nailed it. I mean, I was a youth leader. I also, again, it didn't happen this summer, but every summer I run a music program where we do a theater program all summer and then perform a show at the end of summer with kids from about kindergarten through 6th grade. They're germ factories. It's just the way kids are, right? And kids, the mask thing in school, as much as I want to say that, of course, there's going to be some kids that are going to have no problem. They'll sit, but there are a lot of kids that the finger's going to go under it, up the nose, and you know, it's going to reach down, and then either they're going to be, you know, I mean, again, it's kids. It's going to be like, well, that kid has a Superman mask and I have a Spider-Man. Like, you can just imagine what the teachers are going to have to deal with it on that level of all that kind of disaster drama. Like, and this stuff isn't being thought through completely by people, I think, that actually work with children, right? Just like the whole COVID and what's going on with testing and stuff isn't actually being thought through and listened to by the people that are dealing with it on the front lines, like you guys, right? Like, this is what needs to happen. This is what, in my mind, government has been missing for a long time. These decisions should be made by a group of nurses and healthcare workers and doctors, and all sitting around like, what are you seeing? What are you seeing? What are you seeing? And then work on a plan. Not like Jimmy said, like in 8 hours, there's a shift because something had to be done, but everybody's left scrambling, right? Because the people making these rules don't know what it's like to run a bar or restaurant. And I mean, I'm not gonna lie, the stuff that you were saying was truly horrifying. And these are things, though, that I have heard a little bit too going on. I mean, I have a friend that works at Geisinger, and she is very concerned that they're not testing enough to see if a positive person is actually negative then, because they are seeing a bunch of patients that tested positive in April, came back in June with a flare again. And they don't know if that person recontracted it, or did they still have it and it just was kind of dormant because they never did a test to find out if they truly were negative, right? Like, this is also another issue that foresee is going to be a big problem here, right? Is the quarantine, the 14-day quarantine, is that really enough? I don't think so. I honestly, I think it's a good start, but I think in a lot of cases it is lasting longer. If you have to be on a vent for 21 days, why is 14 days enough? Do you understand what I'm saying? For you to be, if you're doing it at home, like if you're that sick when you're in the hospital and you can be on a vent for 3 to 4 weeks or 3 weeks, then why, when you get home, is it only 14? Like, I just have some issues on are we throwing people out too soon? And go ahead, Sam.
That's actually a very technical question. So the 14-day quarantine, though, is basically has to do with the incubation period. So at the end of 14 days, you should test, because you need to find out if you have come down possibly with an asymptomatic case or light symptoms. You would ideally test at the end of 14 days. If you were positive, you would again need to be, confined. If you were negative, that would tell you, I didn't catch it in my 14-day incubation period, potentially, and so now I'm in the clear for now. I can go out and get it again or get exposed again. So that is a confusion that people have, and we don't have the testing for for people without symptoms, so it's sort of moot. That's why we all have to imagine we are all sick and wear the damn mask.
Yeah. And see, that's
if you ask Kim, she's working with Dr. Levine with the Nursing Council on reopening, but she has to leave soon.
Okay. Well, Kim, why don't you go ahead then? Let's move on here and hear what you're hearing and seeing.
I'll have to be really quick here because I do have to go. But I'm in long-term care and I'm nurse education now, but in long-term care we do, and I'm also on the advisory council through Nurses of Pennsylvania. So I work with Dr. Levine with a group of other nurses, talking about, PPE and other things that are going on in the state. So, but in long-term care, I did want to state that we are having a lot of issues with, getting the PPE in a lot of different areas and all that, and actually being able to give the employees, a change in the PPE, like the mask and everything, on a regular basis. So right now, on average, most of the places around here, they're changing them like every 5 to 7 shifts. So we're wearing the same masks and all that. And we're to put them in a paper bag and keep them, and we're only to change them if they get dirty or ripped or something along those lines. And this is not changing them between each patient. We're wearing them for the complete 8 to 12 hour shifts, sometimes 16-hour shifts. And
Kimberly, you're describing like what 17th century surgery was like, where they didn't change their aprons, right? So basically a mask that's covered potentially with virus particles. Okay, just want to make sure I understand.
Yeah, I mean, I've had C. diff before, and like people don't understand. Like, you go into that isolation room, you put, you're shielded down and stuff, and then when you leave that isolation room, that always supposed to go into a special bin, and that's not happening right now. Yeah.
So the isolation rooms would, depends on the facility. I'll just put it that way. But I do a lot of clinicals now. I'm no longer working as a charge nurse. I used to be a charge nurse at a long-term care facility a few years back. And now I'm a nurse educator, and I actually do clinicals in a lot of these same facilities. So I bring my students in, yada, yada, but we still work one-on-one with the patients and all that. And we see that, we are wearing, they're wearing these masks that they've been wearing for, days on end. And everyone is being compliant with wearing the mask and everything. But we're also seeing that, they are being compliant with, the COVID-19, units. But, they're not supposed to have nursing staff from the COVID-19 units working in the regular units. And they don't on the same shift. I'll put it that way. But in some of the clinical sites, I've actually been told that people from the regular units can be floated to the COVID units on the same day, but not back from the COVID units. But if they work in a COVID unit, that they could technically, the very next day, as long as they're not showing signs or symptoms, they could work in the regular unit. Yeah, as long as they're not symptomatic or anything like that.
Kim, with the same mask that they wore in the COVID unit?
No, at least not that I'm aware of.
Okay.
Now, on top of that, they're having, of course, staffing issues, as Shelby told you, in a lot of these facilities. This is one of the, as you said, 400 comments that you got, is a lot of these places that are commenting on Shelby's, question on Facebook is a lot of these places are actually from long-term care facilities, a lot of these nurses and ancillary staff, so aides. And so they're leaving and they're not even showing up to work, because if once you show up to work and if you were to leave, you would be considered, it would be considered
Abandonment.
Abandonment. So if they don't show up, it's not considered abandonment. Therefore, it leaves the previous staff or previous shift to cover. So now shifts are doing doubles a lot of times. So we have normal staff that are doing doubles multiple times a week. They're getting burned out even more so than before, which we already had an issue with before this whole COVID thing happened. And people are quitting. They're just had it, and this is what we're seeing in long-term care right now. And I actually I became aware from a couple different people, but in particular, one case where a unit had only 2 aides on for almost 50 people on a unit. And they were expected to feed, it was probably at least 10 people that need to be fed. And they all needed to be put to bed that night. And they had maybe 2 nurses to pass meds, do treatments and all that. So, and, this is a reality, and this is on a regular floor. This was not a COVID floor. This was a regular floor for long-term care people that, they're there for a reason, and they are not able-bodied. 90% of them can't even walk, and they need almost total care. So tell me how 2 people and, 2 nurse aides and 2 nurses that need to, pass meds and do treatments, and if there's any discharges or admissions or anything, any accidents, emergencies or anything like that happens, how are they supposed to take care of all that? That's one case, and it's happening all over the place.
Mm-hmm.
And then of course you've got COVID going on top of that. And then of course these poor individuals are not seeing any of their family members, no friends, nobody. So now, of course, you've got that on top of sundowners going on. Right about this time of the day, behaviors start coming out. And how are you going to deal with that? These are things that you have to, what people don't understand that nurses deal with every single day in long-term care. And I'm teaching this to my students every day. And then, and this is just a tip of the iceberg that we're dealing with on a daily basis. And this is what we need to let the public know. And this is what we've been trying to let the public know. And legislators know, and everybody know that, we were in dire straits before, but it's gotten so much worse since this whole COVID-19 has occurred. And you know, I know the hospitals are bad too. You know, long-term care, skilled nursing is bad where I'm at in the sector I'm in. And then, you know, and of course, Eileen's going to talk about hers. Hers is really, you know, where she's working now is really bad too. And then we've got school nurses that are, you know, they're horrified. They're scared to death to go back to work, which of course is something. And then of course, now we're talking with Dr. Levine about all this situation, and we're trying to come up with a game plan. And this is what the advisory council has been doing. We've been trying to come up with a game plan. What is the best way? What is the best practice? You know, how are we going to do all this? You know, and I mean, and are we going to do everything right? Probably not, but we're going to try to do the best we can. And that's what we have to get out there in the public. You know, how are we going to do the best we can with what we have? You know, so, and that's pretty much my spiel on all of this. So, but I do. Okay, go ahead. I'm sorry.
It's just so compelling to hear you talk. And I have been reading articles about this, and I have friends in healthcare and stuff like that in other parts of the country. And so I'm sort of aware of it. But at the same time, it is true. We need people to start getting on board. We need everyone to do what it takes. Again, there's confusion there, because if you listen really to what you're talking about, like Jordy said, it's like, is this like plague doctor thing? Like this is like 17th century stuff. It can be so demoralizing that people just shut down. They're like, well, nothing can be done. And clearly this must just, it's also exaggerated. It can't possibly be true. They go into a very basic form of denial. And they also, a mask, like homemade masks, are such a simple solution that it actually defies belief. People are like, well, we have this horrible problem. How can we possibly solve it with masks? And it's like, well, no, you can't. You have to solve it with many things piled on together. We need to, you know, like I'm the broken record, right? I'm out there like mass distancing and hygiene for individuals. And as a community, as a society, we need to be doing testing, tracing, and treatment, right? Like we need to mobilize. We need to have everyone on board. And we need places like, say, where we are, Jordy and I, which are not yet as impacted, to deal with it now so that we never have the problem. Otherwise, I mean, and instead we have people like, we don't have a problem. Why can't I go to the bar? And it's like, well, you can, and you're screwing us all by doing it, or potentially, so.
Well, exactly. And the thing is with long-term care, okay, in particular, okay, these people going to the bar and stuff like that, guess what? It includes those young people working at healthcare centers. They're going to the bar, they're having a fun, and then guess what? They're getting sick, they're not knowing they're sick yet. They're going in and taking care of your loved one. And guess what? They're getting grandma or grandpa sick.
Right. So that is what I tried to explain. There are people still fixated on the early policy in both New York and Pennsylvania that allowed COVID positive patients to be taken in by nursing homes. At the time, as you all know, the thought was there were more infection control practices in place, and so people would not be as adversely affected. That didn't take into account the airborne factor, which no one knew about at the time. But all those cases have worked through the system by now. Now, our problems are what you're describing, are community transmission making its way back into these facilities through careless behavior on the part of the entire community. And I think people they're just like, well, it's there, only there at risk, and we just have to be careful there, and then it's not our problem. And it's like, no, it's all inextricably tied together. And again, once school starts, it's even more tied together by the little, you know, small scale human vectors.
And guess what? It's not in long-term care facilities unless it's brought in.
Yep.
I'm telling you right now, it is there, you know, and Dr. Levine, she and, you know, put on for long-term care facilities that everyone, all long-term care facilities had to have an initial test unless they've already were tested because they had like a positive case or something like that. They all had to have all employees and tested by July 24th. Okay, every long-term care facility in the state of Pennsylvania. I don't know if you knew that or not, but that was stated, and it was put into place. So every long-term care facility, skilled nursing facility, had to be tested by July 24th. Now, if it was a residential facility, or if it was like a carriage home, or like outside home, you know, like home health or something like that, you could actually, it's not until August. So you can check it out. And so, sorry, condos, for the elderly. Like if you were to look at some, residential and
Personal care?
personal care. Yes, thank you very much. So personal care and residential homes, then it's not until August. But if you are swapping employees back and forth between like a residential and a skilled nursing facility, like some are interconnected, the buildings are interconnected, and you're swapping employees back and forth, and they all have to be tested by the July date.
I think it was reported today that in our paper that 80% had accomplished that, and most of the places that hadn't, theoretically, we're still waiting for results back because there's limited access to lab.
Yeah. They were supposed to have all the tests done by July 24th. So, which is fine as long as they can. Yes, what?
Since that went out, I've had multiple people contact me. They want to know why mom and dad, grandma and grandpa have been in a nursing home. They haven't seen them for 4 months. They had no positive, and now they have 10 positives, and none of their employees are positive. How can that happen? And it's been more than one person has said that. And this is what's with this going around again, because somewhere along the way, somebody's been positive, and it could have been asymptomatic, but we weren't testing. So now you have 10 elderly people that are positive for it.
So Shelby, just because I'm a little bit slow on these things, the answer to the question of how it happened is that there were employees or somebody coming to the building who were positive but were on testing, so they didn't know they were positive.
They were asymptomatic and not tested. Right. Now you have to understand where I live at, people had to drive almost an hour with symptoms to get tested. And like if they went to the local hospitals, some people told me they were literally escorted out of the hospital.
Oh yeah, you weren't allowed in the hospital.
You weren't allowed to go into the hospital. You had to drive that far. Now, if you're sick and you're symptomatic, and a lot of them are older people, they're going to go home and wait it out until they need to go to the hospital. Now, you have employees, which when you get in the nursing home situation, a lot of the nursing assistants and whatever, they're younger. So they're asymptomatic. They could be positive and have no signs or symptom. We weren't testing them, though. So then they ended up going to work, and now you've got, like in one nursing home, it was told there's 10 positives.
So I just wanted to throw out, because I know a couple of us work on elections and campaigns and communication. One thing that I just want to throw this out, and Michelle, maybe you want to respond, but like, I found that because this has become so politicized, and it only takes one side to politicize an issue, I often find myself, because I'm also a local official, I want to raise questions about how well has the state done with giving people guidance about education or with the things you're talking about. But I sort of feel trapped, okay, if I voice those concerns or if I push, right, then it sounds like I'm saying that that Governor Wolf is totally wrong, and it's just sort of you sort of fall into this dichotomy that either Wolf is a savior or he's a sinner. And I'm like, no, the reality is he and his staff I think they're mostly trying to do a good job, but they've made some mistakes. And anyone would. I mean, this is a crazy pandemic, but I don't know if other people feel that. Like this is a really important conversation, and we're on a campaign event, sort of. Hats off to Michelle for being open-minded about this. But I feel stuck sometimes, right? That I'm not there's not like an easy space to bring up what needs to be done better, because if you bring that up, it sounds like you're saying, oh, Wolf is crazy, this is a hoax, we have to reopen everything tomorrow. No, of course it's not, but I'm just saying the political debate has made it that way.
No, that's been my one anger point, because, you know, until the federal government adjusts, makes standard laws that are across the board in every state, and the state and follows through, there's no way we're going to contain this. And I think all the nurses that are on here are going to agree with it.
Absolutely.
Eileen, do you want to give us your story now and what you're seeing?
Sure. I'm just going to kind of put it together quickly for you, but I put some special things down I want you guys to know. First of all, in Warren County, we only have 14 cases, our 14th one yesterday, nursing home, because of the mandatory testing. Patients that were quarantined, one's positive, now been quarantined for months, mind you. So somebody brought that to that patient. Anyways, overall, we're pretty lucky in our area, and I'm very proud of how our county is handling things. I work at a dialysis unit, and it's located inside of a hospital, but we lease space from the hospital. We're not part of the hospital. So our patients have to actually come in to the hospital, and then the next door is the dialysis unit. They're screening patients right there coming in for the hospital. They have to have their temperatures. They're asked all kinds of questions. If they have a temp or meet any one of the symptoms, they can't come in. Our patients know, don't even come if you have symptoms, because you know you're not going to get into the unit. But what they can do, they could actually pull up outside. A nurse, one of us, could go, but we have to have an N95 mask. There's certain policies we have to follow. We can go do the COVID test, send the swab in, then these patients would have to go to another unit to dialyze, what they're calling a cohort unit. Being that I'm in a rural area, the cohort units that we had were either 50 miles north or 50 miles east. So that's just the standard of how it still is. Luckily and very fortunately, we've only had a couple patients with symptoms that have had to do that, but none of them have turned out to be positive. I want you to know, here's a very important thing. The patients coming from nursing homes, because we have a lot of nursing home patients. Couple issues. They're having a lot of problems with depression, for one, because they're locked up on quarantine. They can't see their families. Our patients tend to have a lot of comorbidities and other issues going on, so they do have to have hospitalizations. Then they go there and they can't see their families. I've actually worked directly with a couple of them, and one of them was ready to sign off everything, quit, give up, and die. And his family didn't want that. And I talked with him, I talked with the nursing home supervisor, I talked with his daughter, and the nursing home actually let the daughter and the son come over. They had to meet outside, but they were able to talk to him, see him, be with him. He decided to stay on. Things have really turned out good for that situation, thankfully, but some people are just giving up because the stress is too much for them and they're dying. Our patients also have needs. They have a couple ways of getting dialysis. They have an access in their arm, which is their own vessels, which is the primary goal, because there's no reaction to a foreign body being in your system. Or they get a graft in their arm, or they have a catheter in their chest. New patients usually come with a catheter in their chest. They're temporary. They're meant to come out, we like to say 90 days. They're high risk of infection. That tube goes right in the heart. What happens is, what has been happening is, because of COVID, everything has been locked down, backed up. We haven't been able to get our patients in to get fistula evaluations, to get the fistulas placed. Once they're placed in the arm and the surgery is completed, it takes 8 weeks before we can even access them. So we like to do that right away. We have patients now, they're months beyond. Some of them are getting catheter infections. They end up back in the hospital with sepsis. Another thing I want to bring up, because we've been seeing it, well, twice this week alone, diabetics. Because of restrictions of eating now, because of the masks, they can't take down the mask and eat food, snacks, drink, anything. It's restricted. Diabetics have a problem with that. We've had diabetics that have come in just today, passed out, insulin shock. We're given D50. Thank God it was a couple days ago. It happened to another gentleman, and we, brought them both back around. But these things are happening. Now, had they been outside in the car while they're waiting to come in and it happened in the car, maybe somebody wouldn't have seen them, or while they're transporting in the ambulance. So we're having different issues and different complications and fears for our patients. And when they do come, we go to the lobby. They know our patients are wonderful. We've trained them thoroughly and we talk to them all the time, but they know when they come in, they have to come into the hospital with their own mask. And then once they get in our unit, we provide a surgical mask. And then they come into the unit after all the testing for symptoms, temperature, and all of that. Then we bring them in and do their treatment. The policy it's very strict. But I just want you guys to know that it's so hard for these patients because they can't have any visitors in the unit now. The nursing home patients can't have any visitors there. The patients that go in the hospital, and they do frequently because there's a lot of other things going on with them, they can't have any visitors. So we're seeing more anxiety, more depression, more people giving up and dying, and it's heartbreaking. So here we are. Every day we try to give our patients emotional support in any way we can. We get the phone, we make sure they get to talk to their loved ones, we coordinate whatever we can to give them a little bit of positivity because they need it. They need it so bad, and they have to be there or they're going to die. So, they're already met with a hard situation in their lives. This dialysis is something that they can't live without. Another thing, some patients we had waiting on the transplant list, and when COVID came along, whoop, that kind of halted that right then and there. So they knew they were going to have to wait a lot longer. Now that's picked up again, which is wonderful. And I will say our company's done fantastic, I feel. We've not had any trouble with PPE. They do ask that we wear one mask a day, but they're not restricting us. If something happens, we change out. We're not being disciplined for it or anything. So we're fortunate there, more so than maybe some other facilities. But we've also, I'm a per diem nurse now. I'm no longer full-time. I work 50 hours this week. We've had staff quit when this all started. We have staff call in, no call, no show. We have staff, if they have symptoms, they have to have 3 negative COVID tests before they can come back to work. So they're off. We have one off right now, a week and a half, her 4th time. She has little kids, 4 of them. They all get sick. They get mom and dad sick. It happens. Well, it's symptoms, so you can't come to work. So we're seeing those kinds of issues too. It's such a compilation of an enormity of things that we're all kind of overwhelmed with it, but we're hanging in there, those of us that can and are able, and thankfully haven't developed symptoms of any kind. And we're just trying to give the best support we can to our patients and keep them going. So that's my story. And thank you for having me. And thank you everybody for listening. I think it's wonderful that we're talking about these situations. And it is stuff that a lot of people don't know. They don't see the whole picture.
And when you think about it being across, we're all from different parts of Pennsylvania. We're not in one locality. We are
Right.
all over the place. And it's the same thing.
Yeah, testing for us initially was in Erie, which for me is an hour and a half drive.
Yeah, we were at Butler, which was 60-mile drive.
Hospital wasn't doing it. Mhm. The local hospital said, no, go home. Go see your doctor, stay home. That was the rule of thumb.
Yep, that's what
Just a quick question for you, Eileen. What mental health resources are there for the frontline workers like your dialysis nurses and all the other people that are there resources for you guys? Is there something we could do to make life easier for you? What can the average person do to help you?
There are now with my company, but there's other types of facilities, but I know the big dialysis companies all have the same thing. We have employee assistance programs. I've called them, I'll be honest, not during this time, but I have in the past. And if you need help, if you're having anxiety or fears, or you're getting, too stressed, they actually set you up with a counselor. Do you need a psychiatrist? Do you need a psychologist? They set you up with somebody in your local area. You can go see them and be treated. So we've got that kind of support. We also have social workers on the unit, and God loves social workers because I think their hands are so full with their patients alone, but then they deal with the staff too. I mean, the staff goes to them and they say, you know, we need some help. And they coordinate, or they set you up with somebody, and we can give you somebody to call. And then you can also go to your local doctors too, which I've done in the past, and they'll help you. So there's a few different things you can do. You just have to do it. I've actually done I've done those things over the years. Now I've gone through so many different things. I've learned how to handle it, how to manage it, how to stay at that level of, I'm going to be okay. I just have to get a good night's sleep, get my thoughts together, readjust, and move forward. And I try to encourage the younger, the newer staff, you know, here, this is a number. I want you to call them. Honest to God, they'll help you. We help direct each other to where we can go for help. So sometimes you need to coordinate that with your staff within your facility.
All right. And the follow-up question is, what can we do as average people to help you guys? Is there something specific that like you guys need that we should be fundraising for? Is there like you said, the diabetic patients, you give them insulin, but snacks, I don't know, I'm just trying to think of things that I could do to help the dialysis units in my area.
We've actually talked about, like you said, Jimmy, snacks, and thank you for your thoughts of thinking for everybody else. You're just wonderful. And yes, we have had patients come in, and we have started providing some snacks and encourage family to send in snacks, especially for the diabetics, because they need this. We can't restrict them from this. I almost got into a little disagreement the other day because I was saying, I'm going to get her a jar of peanut butter because that's all this little lady wanted, because her family sent her some dry crackers. She didn't want that. She wouldn't eat it. If she had peanut butter on it, she was happy as heck. So now I call her the little peanut butter lady. And we got her some peanut butter. So now she comes in, she has her snacks, and she's okay. She gets through her treatment. That we need to see that that's important. Sometimes it's the littlest thing that a patient needs, you know, not their treatment and their meds and their histories and their all that. Some of them don't even want to know. They just want to be taken care of, and giving them a little snack or a little drink or something helps. A blanket. In dialysis, it's cold because we have to have the unit cold because of the machines. They all get chilly. We've had church ladies make little Afghans to put over their shoulders. We don't provide blankets in our unit, so things like that are so helpful. Blankets, because they need them.
Could we do some sort of drive, like to have handmade blankets made or something that Jimmy and I could organize to donate to your unit or something like that?
Oh my gosh, I'm telling you, that would be awesome, because I think all the little shawl blankets that we had, we've given out. Okay. and now we've kind of lost contact with everybody for a few months, so nothing's really been done since then. And one of the girls went down just today and kind of borrowed some, should I say, from the hospital, some bath blankets, and we're not supposed to do that. But we did because our patients were chilly and they didn't have a blanket. They get one when they start, but they forget them at home, or they lose it, or something happens to it. So we need to have them there for them.
This is something that, Jimmy, we'll have to talk about this, and I want to talk to Sam and Kristen, because this is something that we could do through Spotlight Orange.
Right.
Uh-huh.
What I was thinking.
Make it a big community thing, and we could organize that. What do you guys think?
Oh, wow.
Yeah.
I can tell you any dialysis unit could use something like that, because they're always chilly. Even with the one blanket they get, it's often not enough. Blankets and pillows.
Yeah, I mean, when I used to have to go to the hospitals a couple days a week to get my treatment, I sat with people that were getting like Remicade and stuff like that, and you nailed it on the head. Like,
comfort.
There was one little older woman, and she had such anxiety, but like she had her little chair, and like when it was her day, the nurses knew like that chair needed to stay open for when she came, because otherwise she would have like a panic. Like, people don't understand that, like, people like
Yes.
Things patients need, that familiarity that make them feel better.
Yes. We had one little lady that cried from the beginning to the end of her whole treatment. And we tried TV, we tried somebody talking with her, we tried different things, but it was great. Just here about 2 weeks ago, they gave her a book with colored pencils. You know, those beautiful pictures you can color now, they have numbers and stuff. She loves it. It's like, oh my God, it changed her life. Another little older gentleman, Western movies. So one of the nurses, her husband sent in DVDs of Western movies, changed his life. But you got to work at it to find out what they need. Everybody's different.
Yep.
But little things to take their mind off of what's going on and to make them comfortable there.
You know, one thing we need to be concerned about too with COVID, one of the side effects of COVID is renal issues. So the dialysis units are going to be seeing more and more patients.
Shelby, is that like lifetime or just sort of an extended?
This is too new. They don't know what they're
They're
finding.
saying there's a lot of the studies that they're doing now, the comorbidities that they're showing a lot of these patients have are hypertension and diabetes. Those are the two top things that bring patients to dialysis. So it's kind of intertwined there.
And until the research goes further, but what they're saying right now, after you recover, they're seeing signs and symptoms of renal damage.
Yes.
And so this is what we have to deal with, and we have to make sure that everybody's taken care of. So, and it doesn't matter the age. That issue does not have to do with the elderly. This does not matter how old you are. You could end up with renal issues.
I mean, tying that back into some of what Sam said about how the numbers get reported, I've been frustrated. I feel like a lot of the focus is like how many deaths have there been, but
We can't hear you, or I can't hear you, Jordy.
Oh.
How many deaths there have been? Is that better?
Yeah.
Mm-hmm.
And it's just, I mean, from the people who have, I don't know what proportion of people who are tested. Well, anyway, people who have it more seriously. I mean, it's an awful disease. This isn't like a cold, obviously. I mean, even people aren't hospitalized. And I guess, one of the things, Shelby, you're saying is, the comorbidity of things. I'm just throwing this out. I realize but even people who maybe even aren't hospitalized, if they have, are there cases of moderate symptoms and people who may have other comorbidity longer term, even if they weren't hospitalized? Like, we don't know yet, but
Yes.
So people are showing signs of high blood pressure clots. They're finding. I had a lot of nurses reaching out to me when they were first doing the signs and symptoms, and this didn't fit into it. And they were saying they would actually go to discharge a patient and they would find them dead.
Yes.
These patients were ready for discharge.
That suddenly.
And they're finding now it's clot issues that goes with it, almost like a thrombosis or emboli, something that's going on. But they're just now starting to do autopsies on some of these people that have passed away. And until we find out, is this thing mutating? What's going on? Because what's happening now is not what was happening to begin with.
I've been following some of the studies, and just this morning, and you guys are going to, or Shelby, you're going to laugh anyway. I listen to doctor radio when I'm going to work and back. Sometimes, not all the time, but I did this morning. And it was a doctor talking about COVID-19 and the studies they're doing after autopsy. And they're finding clots throughout the whole body, more in the lungs and the heart, but in the extremities. And megalocytes in the blood, which come from bone marrow. Those cause platelets to clot. This is part of this disease, because I thought that one young actor that, first of all, he lost his leg, and I'm like, initially I'm thinking, how did that have anything to do with COVID-19? But then when they started talking about the clots, it's like, oh, if you're getting clots, you're not getting circulation. Well, sure, you could lose an extremity. Or your lungs are, you're going to get a pulmonary emboli, or you're going to clot in your heart, and you're going to have a heart attack, or so on and so forth.
And then this is where the people start saying, well, it's not, this is where they're lying about how they're dying, right? Because this is where the conspiracy start, people saying it's not happening because they're like, oh, they're registering every death as a COVID. And I'm like,
exactly.
Like COVID could be causing a different issue to flare up. Like they don't understand that connection.
Right.
Yeah.
It could cause the heart attack. Yes. It could cause the loss of a limb.
There is a correlation between blood clots and COVID, but we don't know how or why. That's what
There's studies. Studies
it's
are
almost like there's a little bit of a mutation to this, and they don't know how much and where it's coming from at this point.
Okay.
Well, I think actually, I mean, the New York was documenting clotting issues fairly
Yes.
early on. So, and I think they're now going back and looking at Italy and seeing that as a pattern, but it just, people weren't aware of it because everyone was just like slammed at the time. So retroactively they're looking at it, and the issue is the clots, like you said, can themselves, they could be stroke, they could be in the brain, they could be in the heart, they can be, an aneurysm, they can be a clot in the leg, they can go to the lung. You can have a clotting issue that itself can play out in many different ways.
Exactly. Yes. Yes. And we're seeing that so much more. I mean, in the studies that I'm trying to read up on, and they're fascinating as far as how this is working, and frightening almost.
Pennsylvania still seems like it's in a sort of middle ground. Like we haven't gotten to that state of just like you test anyone at the hospital and it turns out they have it. Because that was what was happening in New York towards the end of their spike, was people would come in for other things and they would just get tested, and not knowing it, they would have COVID, right?
Mm-hmm.
Or they would do, they'd scan their lungs and be like, how
Wow.
can you breathe? So,
Exactly.
but if you look at our numbers, we're on the edge, right? We've been near the spikes of New York and Connecticut and New Jersey, but so we haven't, but we've avoided being that high. And now there's other spikes happening further away. Like even Virginia doesn't look great. And I hope we can just sort of skate under and stay at it's still too high. We should tamp it down. We should really be on top of things, but we don't want to get to the point where it's just assume everyone has it. I mean, that was what they found in New York when they started. They were just like, at first they were saying in some hospitals, we will only test, people in the maternity ward if they have symptoms. And then they were like, well, we tested everyone for 3 weeks and 80% of them had it, So then they're like, okay, we're just going to assume everyone has it. I don't think we're there yet, at least not in our part of the state. I'm not sure about Luzerne and further afield, but it would be nice if we could stay not there. And that's the, people are like, well, we don't have that problem and therefore we should be able to do everything. And I'm like, no, we don't have that problem because we've been avoiding it. And we don't only get to stay that way if we continue avoiding it. How is this that hard to understand?
And
Yep.
the thing that cracks me up about it is the simplest thing you can do is just wear a mask. And people have made it such a divisive issue. Just put the darn thing on, and everybody wants life to go back to whatever sort of normalcy we had before. That is the simplest thing we can do right now. The simplest thing we can do. And people are fighting it left and right.
People will find more reasons not to wear masks than to wear masks.
Well, I had
Right.
someone come in the restaurant the other day and said, I have a medical reason not to wear the mask. And I politely asked him to leave, because if you have a medical reason not to wear the mask, you shouldn't be out to dinner. It's that simple. You shouldn't be out to dinner. And believe me, it killed me inside a little bit because I'm turning business away. But the damage that it could do to my business, if somebody even mentions, oh, I think I got it and I was at Vesuvio's eating, it's a long-lasting damage. I would get support of public opinion,
Jim, that's a valid point that doesn't get brought up. Like if your business is tied to like somebody got sick and then maybe God forbid somebody passed away, like that's gonna kill you.
Right.
You made the right choice. It's an awful thing to do, but like you have to also think about the longevity and the safety of the people even working in your business, right? Like that person could be a carrier and they don't know it.
Right. It's not just like my business, but it's like you said, it's my workers. It's the other customers that are there. It's a lot of things. And like, from my perspective, I think getting back to mental health, we should talk more about mental health, because I think there's a lot of people, not just in the medical field, that need it. I think there are a lot of business owners out there that have carried the weight of the world on their shoulders. And I am lucky because I share that burden with my siblings. And I have a great brother and a great sister, but now my sister's getting married and my brother's having a baby. So they're focused on the business as well as their personal lives. So mental health should be something that we should be talking about across the board for everybody, because
Yes.
this is unprecedented. Nobody
It
has
is.
gone through this before. You know,
Yeah.
you have, and it's getting to the point where you think of things like, oh my God, what if they get sick here? Okay,
Yeah.
and now you have to worry about, like, you're worrying about things that you never had to worry about before.
And
Yeah.
if you think, like, I mean, I'm going to be completely honest, like, there's been days when I woke up and I'm like, I don't want to get out of bed. I mean, if let's be honest, if you're not having what, like, I'm just being honest right now, this is extremely hard. Like, and if you're doing okay and stuff, more power to you. But I think we need to have a moment here and just be like, it's okay for you to look at your family and say, today I'm not good. And there's no shame in it, because this is not normal. Like, what we're dealing with, the stress, not being able to go out that much, having to convene over a computer like this, you know, it's great. And we're so lucky that we have this, because if we didn't have this, I think I'd be losing my mind even more. But we need to acknowledge that this is hard, and we're going to have days, and it's okay for you to just, like, want to curl up in a ball and maybe just watch a movie for a day and take, like, and I think that, and I'm sure Christian is listening right now because he's a big mental health advocate, and this is something, again, Jimmy, you nailed it on the head. We need to have these talks. We need to, especially with our healthcare workers and their stuff, that are people that are dealing and seeing this stuff and this stress every day. The weight of the world is literally on everybody's shoulders right now, right? Like, Jimmy, you're trying to keep your business afloat. You have employees, you have patrons, you have a community that you're a part of. Like, it's not, you know, I think maybe COVID has also highlighted something that I've always believed. We're more than we realized we were. Like, I think we didn't realize how much we need each other, right? That lockdown was hard, right? Not being able to go to the person that lived next door to your house was hard. It was hard telling my child, you can't leave the house for a while. I'm sorry, honey, you cannot leave this house. He didn't understand it, you know, but it's great if and that's what you're saying, like, wear the mask. If you want to be able to go out and sit at a restaurant for a couple hours and maintain a little bit of normality that we desperately need to keep going, just put the mask on, right? Just put it on so we can do this.
And like he said, if you can't wear the mask, then ask for accommodations that don't put other people at risk. Mm-hmm. Say, do you deliver? Can I pick up curbside? Is there some other remote option that I could use that would not require me to wear a mask? It's like, if you decide that you have some, which is not, I mean, there's a vanishingly small number of people who realistically can't wear a mask. I hear from a lot of people who are like, I can't possibly because I have asthma. And then I have all these other asthmatics, like, I'm wearing the damn mask. You know, or I can't wear it because I'm claustrophobic. And I have other people who are claustrophobic who are like, I am more scared of getting sick and getting other people sick, right? That's I don't want to get someone else sick. Right now, I'm wearing the mask. You know, and what I really find is it's not the employees who are the ones who are going to have to wear the mask for hours and hours. It's people who are being asked to wear a mask for a little while that are least likely to be willing to wear a mask. It's amazing.
I just want to say in the mental
We can't hear you again.
Oh, what have I done wrong here? Is that better?
That is.
I just want to say in the mental health department that I haven't had Jimmy's pizza, but he said Vesuvios, and I swear I started smelling pizza. So I think he has magical properties.
Really wish I did. I really wish I did. You know, I've been trying to perfect the dehydrated pizza from Back to the Future. It's just not working.
That doesn't sound good. That doesn't sound good.
It's not working.
But
hey, you guys are all welcome to come up and, you know, wear your masks until you sit down at the table and have a beer, but only with your meal. I mean, just, you know, I can give you the litany of rules. I've committed them to memory because I don't have 200 grand to go buy another liquor license. And that's the way they're choosing to enforce these rules on us, is basically through our desire to continue to, you know, do business the way we've been doing it for
Do you do mail order?
For you, anything. Trust me, I always tell Michelle, candidates eat free. But
One day, Michelle and I will be there.
All right.
Now, one thing I want to bring up is the fact, while we're talking about children in school and mental health, we have so many young people that are addicted to drugs, that they're losing their children are being taken away from them, and the grandparents are raising these children. You open up the school system, who's going to protect these grandparents? And that's happening more and more. I mean, it's not just like I myself, I don't have a problem with the mental health, but my son lives here and his daughter's here 4 days a week. She goes to school. How do we protect the people who have that aren't even involved with the school system? And they're going to be involved whether they like it or not. And a lot of these, I know there's some 80-year-old people that are taking care of their grandkids.
I would like to address that really briefly because I'm going to have to go soon. But the CDC, which had, of course, issued guidance for schools that was too stringent for some people's taste, did reissue guidance last week, only just on the 23rd. And that reissued guidance, one of the top items on the sort of short list of things that the school districts need to be doing is messaging to the community as well as the school the importance of mitigation efforts across the board. In other words, helping the community to understand that the school can't make this work on its own, and everything that's happening or not happening in the community is going to rebound on the students and ultimately their households and the teachers and everyone else, all staff. And that is embedded in those CDC guidelines. That's the good thing. The bad thing is whether people actually take that to heart or understand what it means. But they are pushing multiple mitigation avenues, mass distancing, hygiene, and cohorting for schools. Ideally, they should also be pushing outdooring, as much as possible.
Yeah, so it's 9:20. Let's figure out some. It goes fast. I think we're gonna have to definitely do a follow-up town hall at some point about this, because this was a really interesting. I mean, we just touched on a million different things here. So why doesn't everybody just take a minute and just say like a closing remark here before we go? Shelby, do you want to start?
Well, first of all, I want to thank you for inviting me. And I want to thank all my friend nurses that showed up as well. Give a care to the public. I mean, the people that are working in the public, I guess I should say. You're talking the nurses, the nursing assistants, everybody in the hospital, the guy who pumps your gas, the guy who is bagging your groceries. Give them a break. I don't know how many people have told me how rude people have been to them. If they can't get a gallon of milk, okay, that's not that guy's fault. If the nurse has 30 patients and she can't come right to the phone, that's not her fault. Just kind of like everybody take a deep breath and have a little understanding for their neighbors.
Thank you so much, Shelby. And I thank you so much for running and stuff too. I think it would be absolutely amazing to have a nurse in Harrisburg. That would be off the charts. Yes. Amazing. Yeah. I'm not gonna lie. Like when I found out she was a nurse, I'm like, that is desperately needed in Harrisburg. Those legislators have got to hear from somebody that actually works in a healthcare facility. What about you, Jordy? What's your closing remarks here?
I'm glad you called me, because I hope whoever goes after me has a more upbeat thing. But I just want to put this out, which is I think in the larger political context with what Trump especially it has been doing, is that he sees that the pandemic and its reality is a threat to his fantasy world he lives in, where everything's great, and he is already starting to undermine the CDC. I've seen stuff about trying to change the way they report data, and this is a classic move in the political among politicians. Is if you shut down the data, you shut down the story, and so for a while now, I think we've been able to sort of anybody, and this should be regardless of party, has been able to say, when people say, what should we do? We could look to the CDC, who are our leaders of, science-based, data-driven public health information. And I'm afraid that that's going to run out. And so we're going to be in a harder place where all of us especially who are in the public eye, either we're in office or running for office are going to have to pivot and be able to talk about, you know, we're going to have to become more the experts. Like, I hate to say this, but I think we have to become our own, you know, we're almost going to have, each of us have our own advisor about what is actually the best available science on public health, the best available science and data on public health, because sadly, we're not going to be able to rely on our public health authorities because we live in an era of conspiracy and the undermining of trust in public institutions.
Yeah, you're exactly right, Jordy. I mean, that's again, like the thing, like running for, again, I decided to run for office, you know, last summer, did not foresee any of this happening. And now, like, this is our job, right? This is your job as an elected official. This is my job as running, is to try to explain to the community what's actually going on, right? It's fallen on our shoulders. And I think you're right. As this gets going longer here, it's going to even fall more heavily on our shoulders. And it's, you know, you could say it's not fair and stuff, but I care about my community. Shelby cares about her community. Eileen, Sam, you, Jordy, Kristen, everybody watching. That's why we're doing this. And that's why we're going to keep this information coming out. And hopefully Spotlight Orange can also be a vessel for that, so that we can get this information out to people in a way that they can digest it and understand what's going on here. Eileen, how about you? I want to thank you, Eileen, personally for sharing here. I think that what you said was really touching, and I'm sure that everybody that's listening to this, I'm hoping that I can edit this down a little bit and take like your part and Kate's part and take some of this, and maybe we could highlight that on Spotlight Orange, because I think this would be a great thing for people to hear. Give us your final words here. And again, thank you and Shelby and everybody, the nurses that have come on here. I know you guys have a hectic and busy life, and from the bottom of my heart, I thank you. Oh, gotta unmute here, sorry.
There, you hear me now?
Yep.
Sound like a Verizon commercial. No, I just want to say, no, thank you guys for asking me to be on here. Shelby for contacting me, and Shelby and Kim, they're my cohorts now, and we're in this for life. So, and we've been nurses for life too, and we always will be, and we'll be advocates. And I say, we've always said it's a big part as far as being a nurse is educating our patients, educating the community, educating our families. We do it every day. We try to explain how things are happening. And I think with what's going on right now, the most simplest thing is I tell people, you know, sanitize, wash your hands, wear a mask. That right there alone is going to save many. It can be so simple, but it can be made so tough too. But let's just stay simple with it. If we want to do some education that's very basic, that's going to be able to sink into everybody, wear your masks, hand sanitize, wash your hands with soap and water, and be careful, be cautious, be concerned. And that's what I'm going to continue to do, you know, is be cautious for myself and my family and anybody that I'm around, my patients in the community, and keep educating people, and hopefully that we'll all get through this. I believe we will, but it's going to take a bit of time here yet. I don't know how much time, but it's going to take some time.
Well, thank you so much, Eileen, and
Sure.
Thank you for sharing, and thank you all you do for your patients and your community from the bottom of a heart from everybody on here. We look up.
Thanks.
I mean, I admire you. I can imagine what it's like to be a nurse right now. So thank you. And we'll be in touch here, because I really would like to highlight you on Spotlight Orange and your story, and also see if we could do a sort of a blanket drive for your patients. Okay.
Okay. Thank you.
Yes. Thank you. Oh, Sam.
Okay. Well, again, thank you to everyone. I really, it was very helpful to hear from everyone, and I'm glad to make the connection, and, you know, want to hear more in the future. I agree. I would emphasize the time issue that Eileen just brought up, that one of the biggest issues is, again, there are delays. There's delayed effect with the economy, like we talked about. We're only just beginning to see the pain, or or the next round of pain is about to start. There's also delays. It basically takes about 6 weeks for the consequences of changes to happen. So our area, more protests, we're going to start seeing the consequences of those in our area soon. We're already starting to see them in other places like Minnesota and stuff like that. 6 weeks is a really long delay. People's brains don't connect something that happens today to things that happened 6 weeks ago. And you start thinking about contact tracing. What if someone told you today that you were positive and you needed to recreate all your contacts over the last 2 weeks so that you could figure out who you might have exposed? Could you do that? Who were you talking to 2 weeks ago, right? That's why we need to wear the mask, so that it is not as critical. Wear the mask, do the distancing, wash your hands, and push for testing, tracing, and therapeutics and treatment. So those are my broken record calls to action.
Real quick, if we actually hired everybody to do the contract tracing that's needed, would that erase the unemployment?
It actually could. I mean, it could be a massive employment effort, though, to be honest. So JAMA had proposed using all incoming med students, like an entire cohort of med students, and sort of making them people who had a sort of crash course in public health. And so it would be better. One of the issues is, could that cover it? We have so much of a problem now. We're like in the places where we have rampant growth, they're past contract tracing. They can't do it anymore, like in Houston.
Well, it also goes to, I know I'm supposed to be quiet, but this whole issue, like, I didn't realize the Defense Production Act hadn't been enabled, but like,
nope.
What do we need? Sounds like we
PPE.
We need PPE, swabs,
yes.
Tests. Let's rapidly
ventilators.
assemble.
We're going to need ventilators.
So
we
there's a lot of
the pooch. Sorry.
There's a lot of unemployed people, so we need to stop figuring out how to get them to figure out how they can work in the bars and restaurants that are closing, and how they can get jobs in these rapidly assembled manufacturing facilities. Look, we did this in World War II. We can do it again. We just need
only if we have the will.
Some leadership.
Kristen, real quick, any questions or anything before I wrap up here? Anything that you need to say?
Nope, no questions.
Okay, all right. Again, if you want to follow Shelby on Facebook, her Facebook page is Shelby RN for Senate. So please like that and follow along for her campaign and support her in any way you can. Us rural girls have to, stay together on this.
Absolutely.
And, again, you can follow my campaign at michellesiegelforpasenate.com is our website. Siegel for Senate on Facebook and Instagram, and Senate PA on Twitter. And again, we'll have our town hall again next week at 7:30. So look for that. We'll send some information. And again, if you get a chance, you're hearing about this, look at Spotlight Orange on Facebook. We also have a website you can follow, and we'll have information for the community about what's going on and what businesses are doing a good job and what essential workers we're highlighting. And so look forward to that. And again, I thank everybody, Jordy, Sam, Shelby, Eileen, Katie, Kim, all the nurses that came on here. I really, really, really appreciate that so much from the bottom of my heart.